Are you falling? Do you feel that you have to hold on to the wall or the furniture to move from one room to the other in your house? Have you found that you need to brace yourself on a car when you're stepping up on a curb? Or have you seen someone else do that? Chances are you're at a huge risk for falls and serious injury. Hi, I'm Dr. Naznin Jamal. I'm board certified in internal medicine, and my goal is to empower you and your loved ones to understand medical diseases and basic medical concepts. So let's begin. Falls are a leading cause of serious injury and deaths in older adults defined as 65 years or older. Women are more likely to fall than men, but they are less likely to die from them. In 2021, we had a total of 38,742 deaths in older adults from just accidental falls. Now, the United States Preventive Services Task Force, also known as USPSTF, convenes every few years and commissions reports to review all the data and research regarding medical diseases and concepts. And they issue recommendations to physicians on how to treat their patients according to the standard of care. And they recently released a recommendation that as physicians, we need to screen our patients for falls. So how do we go about doing that? First, we need to identify the risks that are associated with falls. What are risk factors for falls? Older age. If you're in your 90s, your risk for falling is greater than if you're in your 70s. Cognitive deficits, changes in memory and function. Your reduced ability to focus, concentrate, and short-term memory can impact your ability to fall. And if you have difficulty doing simple tasks on your own and need help, can also make you weaker and vulnerable to falls. Sensory deficits. If you're having difficulty sensing pressure changes or in your feet, such as if you've developed a neuropathy. Medical diseases can contribute. Medications can contribute. Medications that I'm thinking about include blood pressure medicines that may be too much for you or too many. Anxiety medications such as benzodiazepines that include Valium, Xanax, they can contribute to falls. And then narcotics for pain control. These opioids can contribute to your risk for falling, and they alter your awareness and the ability to prevent a fall. And then finally, alcohol use. So how do we as physicians go about identifying your risk for falls? Well, when you come into the office, we're going to do a comprehensive exam. We're going to observe how much time it takes for you to get up from a chair, walk to the door, and take a few steps. We're going to see if it's easy for you to do that. The longer it takes for you to do those things and those steps can contribute to your risk for falls. We will screen you for depression. We'll also take a look at your vitals, such as your blood pressure, and see if there's a risk or a change of blood pressure from sitting to standing. Major drops in your systolic or top number of your blood pressure from sitting to standing can portend a future fall. We also take a look at all your medications that you use for pain, for anxiety, anything that has a sedative effect that can alter your awareness and your ability to ambulate. We'll also examine your cognition. At this point, memory impairment will be asked about, and we can do a series of tests that consist of questions to see if you have any compromise in your mental function. Let's say we do identify a risk for falls. We may refer you to physical therapy. We have quite a few physical therapy programs to offer. We've got the home-based physical therapist. Home health care will send a physical and occupational therapist out to your house 3 times a week. That's usually only an hour at a time. We have even more aggressive therapies such as outpatient rehabs and inpatient rehabs. And then finally, we can also refer you to a physical exercise program at a local gym. Group therapy sessions have the added benefit of social stimulation. You have to be homebound to get covered for a home health physical therapy evaluation, and Medicare does cover quite a few of these options. Folks, falls happen. In my line of work, I admit 3 to 4 people minimum per week who have fallen in their homes and developed hip fractures that need to be operated on. These small interventions can make a difference in you being able to live in your home independently longer. If you're 65 years or older, call your doctor today to get an appointment to be reviewed for your risk for falls. Until next time.